All right, we are live. Okay, so we're all going to introduce ourselves real quick. My name's Paige.
I'm Vaughn Hokinson.
I'm Emily.
I'm Alice.
And Tabitha?
I'm Brianna. I'm sharing Emily's computer right now.
Awesome. We are all here today. We're going to be talking about our parent interview that we had. We're going to let Vaughn go first because he has some stuff going on in life that makes it exciting.
Thank you. Appreciate it. Okay, so let me go ahead and tell you a little bit about my interview. The young man whose mother I interviewed, I've known her for about 6 months now. I've talked to her a little bit about this young man. I'll call him D. I've talked to her about D before, and I've been coaching him private gymnastics lessons, and he has been diagnosed with autism. So it was really neat to visit with her about what the experience was like as she started to recognize that he wasn't, I guess, developing typically. So little background on her. She has a BYU Idaho education, and she is actually majored in early childhood special education. So she recognized a lot of the signs early, and D is her second son. She has two boys, and her oldest son was, he met all of the things that you watch for. He was talking at the right ages. He was walking, and his toilet training went smoothly. All of those things, and then when D was born, he just started to exhibit some of these things that indicated there was a problem. He has a hard time making eye contact, didn't vocalize nearly as early, just a lot of little kind of things. And since she knew what to watch for, she really worked hard early on to get him special attention. She has college students who come in and do interventions with him. And he's now just about 5, and he's working with me doing gross motor and even some fine motor skills because we play catch and stuff like that. So she's been really on top of it, but it just kind of is heartbreaking to hear her tell about how hard it was for her to recognize some of these early behavioral milestones that weren't being met, and then need to kind of internally process what that meant. And for a long time, she didn't want to have him formally diagnosed because she knows a diagnosis can stick with you for forever. And D's really actually an amazing kid. He communicates now verbally, so he's kind of on the really high functioning autism. And again, I think part of that's because she was so quick to get him intervention. So as I was visiting with her, like some of the things that I think that she was able to learn from her education really helped in her processing and finding help for D. So she mentioned one of the things that's been really hard is he's 5 almost, like I said, he's just about 5, and he still has a hard time. He wears a diaper during the day, and just communicating some of his bodily needs has been really the hardest thing lately. And then he's very sensitive to touch and doesn't like to be touched and held a lot, and yet he has a lot of energy and very high motion, and that's part of why the gymnastics has been really good for him, because when I do my lessons with him, I keep him in motion the whole time. So I don't know if I don't know if I've been following all of the criteria for, let's see. So after doing the interview, I guess the things that I sensed that helped me understand what's normal and not normal is a lot of the small developmental milestones that are to be watched for, especially things to do with speech, gross motor skills, and just interacting normally with peers. And as far as the last question, did I sense that she was uncomfortable, had a sense of denial or shame or embarrassment? I think because of her background in special education, she was able to accept it better than some parents. But definitely, yeah, there's still, like, one of the things she mentioned is that she wanted to have a bigger family, but because she knows that D is going to need so much help, they've decided not to have more children, at least in the near future. And so that's something that I think really is hard for her to kind of accept. But she's a great mother, and I'm really it's been a real honor and blessing to work with Dee. I've seen huge progress in his gross motor and even his communication skills. So I really have become aware of how much early intervention can make a difference. So if any of you have any other questions, I think that's kind of a summary and answer the questions. So. I see somebody's little there. Did anybody else have any comments or questions for me?
I think you covered everything. It sounded good.
Yeah, sounds good to me.
Okay.
All right, awesome. Who wants to go next? I guess I can go next. I interviewed a woman from my church. She has 5 children. None of them had any developmental problems and stuff, so that was a little different. But I was talking to her about like just kind of answering the questions that they had on the outline, just kind of like when did they start teething, doing this, doing that. And from what she described, she was saying that they all developed rather early and stuff. Like they were potty trained by the time they were like 18 months old, and then they were walking between 9 and 11 months and stuff, and then they were teething about 6 months, stuff like that. They didn't experience any delays. I guess that their only like milestone that they might have had issues with that concerns development isn't really like cognitive development. It's mostly their youngest daughter. She's considered legally blind, like she can't see well at all, and so it could have put a hindrance to when she was learning how to read and doing like those sorts of things. She couldn't see what she was doing, and so they were like, "What's going on?" And so they noticed that she was squinting all the time and things like that. And so they're like, "Oh, she probably can't see very well." And then they took her to the doctor, and the doctor's like, "Yeah, she's like legally blind. She can't see anything." And so then they got her glasses, and she was all good and stuff. So that was just kind of how they dealt with that. And then for when she was dealing with for interacting with the child with special needs, she noted that there was a child at church who, like in some of the signs that she picked up on, like he couldn't really pick up on social cues, and he was abrupt, and his speech was unfiltered, like he really like didn't like think before he did, sort of thing. If he said something, he was just kind of like, oh no, you know. So, and then he just didn't have very good self-regulation. So that's how the interview went. My sense of normal, I guess it's just kind of what the typical experience is, if it's or gets average, if you will. From the way she talked about the child with special needs, I think that normal also represents what is expected to be proper for communication behavior. And if someone deviates from that, it's considered abnormal. Let's see. Do you think that the parents are often the last to know? It didn't seem like they were really the last to know whether she had, or like referring to her daughter who needed glasses and stuff. I don't think that they're necessarily the last to know that that's what she needed and stuff. They were able to pick up on it just by watching her and taking note of what was going on, and that she wasn't reading and doing certain things as early as the other kids were and stuff. And then, in a sense, the parents were uncomfortable. The only thing that I could really pick up on that was in the interview about what made her uncomfortable was when she was talking about the child with special needs, that she felt like it was awkward and she felt embarrassed for the parents, and she's like she was a little insensitive about it. So I don't know if that really says a whole lot about that. So yeah, I guess that's what I got from it.
Great, thank you.
Yep.
It's good.
All right, sweet. Who
I
wants to
can
go
go
next?
next.
All right, sweet. Do it.
I will. Okay. The mom that I interviewed, she has
I'm not hearing you. I don't know.
I think her froze or her internet or something. Because she's frozen. Did she go? Anybody?
I don't know.
It seems like she's working on it. Oh,
So does somebody else want to start and go since we've lost her, or what do we want to do?
I think that someone should go ahead. Yeah, it looks like she's lost the internet connection, so it'll be a little bit before she gets back.
I can go ahead and go if you guys want.
Great.
Sounds good.
Alright, so for my parent interview, I interviewed my cousin and his wife, and they've been married for 7 years. The dad is going to school to be a teacher, and the mom is a registered nurse. And they have 2 kids. Neither of them have developmental issues. The first child turned 5 in February, and the second child is going to be turning 4 in August. And so when I asked what differences do you see in children in their walking, talking, and teething, the 5-year-old child began walking around 10 months, and the younger child started walking around 11 and a half months. And then the parents said that their oldest son began talking by the time he was 1, and their younger son did not talk until he was around 15 months. So it seemed like both children, their teeth, they teethed around the same age, but there were some differences, like the older brother was cranky when a tooth would come in, and the other one was a lot more calm. And the parents think that the older child will need braces, but the younger child, they don't think will need braces in the future. And then I asked if they were slower at speaking, walking, or potty training, and the parents said that the youngest son definitely took longer to walk and talk. But he's still not as coordinated as his older brother, because his older brother is a lot more athletic. And even though the youngest child learned to talk later, they're kind of at the same age, or at the same speech level today. They're around the same age, so there's not any issues there. And then when it came to potty training, the oldest son was potty trained much quicker and was potty trained by 2, and then the younger child took until about 3 years old. So like overall, the older son was like walking, talking, and potty trained at a faster pace than his younger brother. But there wasn't so much of a delay in the youngest child that there was concerns for the parents. So I asked them if they had any of their children receive special services, and the mom actually said that her oldest child, well, she's concerned that he might have OCD, and that's like the only concern that she has. He gets really frustrated and angry when things don't go his way, and he just gets really bad anger tantrums, and as a parent they try to calm him down and do exactly and say that it's like okay if things aren't done the way that he wants. But they said that hardly ever works, so in the future they said that they might see if it's worse or if he go out of it, and if it does get worse and it's affecting his life, then they might seek services for that. And then I asked about if they felt awkward around children with special needs, and the wife, since she's a nurse, she said that sometimes she has to work with special needs children, and she said that she doesn't mind interacting with them because she knows that like they're some of like the sweetest children that she's ever met. And so yeah. And then again, the only concern that the parents had was that their son might have OCD, but they have like a plan. They said if it gets worse, then they'll seek services. And then after doing this interview, my sense of normal, it just seemed that there's not really a normal in development because you have to take into personality, and there seems to be a correlation between personality and their development, but you also have to watch for those milestones and make sure that they're meeting the milestones at a certain time, and if not, then you should seek services and have some concern for your child. And the parents didn't really have any shame or denial about their son needing services for OCD, but yeah, they're not opposed to services if needed, and that was basically my interview. If you have any questions.
Have any of you ever read A Wrinkle in Time? Whenever I think about development, I always remember the character Charles Wallace in the Wrinkle in Time series, because he supposedly doesn't speak until, I mean, this is a fictional character, but he doesn't speak until he's like 6, and then he just starts speaking in full sentences. But I do think like that kind of speaks to this idea of development not normal development, but personality and intelligence sometimes isn't reflected in normal development or the average developmental milestones, but you just kind of have to get a feel for everything. It's just an interesting topic, I think.
That's a really good point. Thank you for sharing that.
Mm-hmm.
Alright, who wants to go next?
Phil?
Are we all going to be the new group through the rest of the semester? Are we going to be working together? The 4 or 5 of us?
I have no idea.
My group, we were all kind of aware of each other, and then she switched it, so it's a little chaotic. I don't know any of you, so it's alright. It's fun.
Sorry, I just kind of joined for today. I came to my group yesterday, so.
Okay, good job.
Mom, Brianna's here. I'm borrowing Emily's computer since she's my roommate.
Oh, so you're not Emily. You say it says Emily, but it's actually Brianna.
Well, no.
Both of us are here. We're sharing a
Oh.
computer.
Oh, gotcha.
It's Emily and Brianna.
Yeah, my computer's being dumb.
Alright,
Well.
go for it.
Who's going? Do you want me to go?
Go, Brianna.
Go, Brianna.
Okay. So, I interviewed my aunt, and background information on her and her family is, she was married, she got pregnant in high school, and, she and her boyfriend ended up, getting married after she dropped out and had, 2 other children, and then, they kind of, for whatever reason, they got divorced, and it took her several years, but she remarried, and and they have 3 kids as well in her second marriage, and the oldest one out of that marriage has speech delays, and and they all live with my grandparents, and they've been doing that for as long as I remember. So, but this little boy, he has speech delays, and as we were talking, she just mentioned how he's almost 4, and technically, like, since all his older half siblings have had um, have been able to speak at full sentences by this age, and he's not, like, that definitely was somewhat of a concern for her, and so she, like, tried to make sure that it was that, like, he got tested for it. So he got tested and was put into, like, the school district's preschool, and like, something that she's, like, really concerned about is, like, part of it is of, like, making sure he stays in preschool as long as he needs to, because she's had 2 other children that have been on IEPs, and one of them had to go to preschool, and she was moved ahead into kindergarten when she wasn't ready. And when they and so, like, she ended up having to repeat kindergarten a second time because she wasn't ready for it originally. And so my aunt's really wanting to make sure that her son now, like, is gonna get the preschool years that he needs. So, and another concern for her is kind of his health, because he still is preferring baby food over solid foods, and, like, because he was born with a hole in his heart, he had to have open heart surgery, and so, like, they had, because of his medication, he hasn't been able to, like, potty train very well, because he's having to constantly be releasing his urine, and it's just one of those things that it's a lot harder to potty train him with that constantly being in need for him. And as far as her being uncomfortable with, like, around other special needs children, since I have a sister with autism, I don't think she's very uncomfortable with that, because we've had plenty of family get-togethers, and she's hung out at our house a few times, and so I don't think she's necessarily uncomfortable. How she views them, I don't know, but I don't think she's necessarily as uncomfortable with them as what some people are. And yeah, I think that's about it.
That's awesome.
Nice.
Thank you.
Do you want me to go next?
Yes.
Okay, so I just interviewed a family member who the child's really severely handicapped. They don't have really haven't diagnosed her, because there's about 4 or 5 different things wrong, like her hands don't bend, she can't walk, she can't talk. She, like, basically only has about half of her brain, and so it's a really challenging experience for the family. But for different stages and things like that, she obviously never walked. She's in a wheelchair, and she can't roll herself around, so the family members have to do that. As for talking, we talk sign language to her. And then for teething, she actually did not get her teeth till she was about a year old, which is really delayed, because normally you get your first tooth around, I know some babies, like 6 months. As for potty training and stuff, she obviously has to wear pull-ups and things like that, so it's definitely a slower development process. She doesn't go to school. She actually has an in-home teacher that comes because of the medications and things that she takes on an hourly basis, and things like that. It's just too much to have her go to regular school. It's easier to bring a teacher into the house and do those services there. As for feeling comfortable around, is it her parents? So other people, she gets a lot of stares and things like that, but what my grandma had to say about it is that you have to realize that people are not used to seeing someone that beautiful each day, so if allowing them to look makes them happy, then so be it. So she brings a lot of joy to everybody's life. She's a very sweet spirit, but she, can't talk and things like that, which is unfortunate.
I worked taking care of a little girl for about a year who had severe handicaps, severe disabilities like that. She just wasn't
cool.
functional. It's a really neat experience, but it can be difficult sometimes. And I especially feel for the families because there's such a huge demand on them to meet the needs of a child that has this kind of problem.
Yeah, and I forgot she's the baby of 5, and so when she came along, that was kind of a rude awakening. They didn't even know until a week after she was born that anything was wrong. Because it was kind of, they just had to do some experience tests and different things like that.
The little girl I took care of had, she was healthy until she was 2.5, and then she had a disease that put a lot of fluid on her brain, and it just completely disabled her. So.
Yeah, but they really are sweet spirits, and it's learning because we had to learn sign language, and so it's a learning experience for the family as well as the little girl.
Yeah, it's cool. Do we have just one more
Yep.
to go?
Yeah.
I
I'm
have
gonna try Allison again.
I have about 10 minutes and then my class starts. So.
Can you guys hear me?
Yes.
Yeah.
You can.
Ah, there you are. Yay.
Okay, I'll
Welcome
go
back.
quick. And get. My daughter kicked the phone and I turned the microphone off. Anyway, the
She's
mom
cute.
I interviewed, she has 4 kids, and she has 2 boys, and then a 14-year gap, and then 2 girls. And so she focused more on the 2 girls who are now 19 and 21. And she said that the oldest girl started talking really soon, and she thinks it was because her older brothers, who at the time were 19 and 20, talked to her like in a very, they didn't baby talk to her, they just talked normally, and so she picked up on it a lot sooner. Definitely, she didn't have any concerns with any of her kids, but she did babysit a boy who had Down syndrome, and she babysat him for about 3 years. And with him, she had a lot of confrontation with the mom because the mom wanted him to be treated like a normal kid and didn't want him to have any special treatment or be thought of any different. And so he was, on top of having Down syndrome, he was really delayed developmentally because his mom, in a sense, refused to give him any special treatment. And so my mom just kind of helped him slowly and worked with him developmentally where he was at his level. And he wasn't potty trained until he was about 6. He couldn't really form full sentences until he was about 6. He was teething on time. There wasn't any really any physical delays besides for just the ones that come along with Down syndrome. She talked to this mom talked a lot about how she dealt with his mom and how it was really awkward because she didn't want to. I mean, obviously it's her kid. She doesn't want to make the mom feel uncomfortable and stuff, but she had to really talk to her and tell her that he needs special treatment and he needs intervention and he needs people that are trained and have learned how to help kids with this kind of situation to help him be as normal as he possibly can be. I was she didn't really sound embarrassed or ashamed. She felt, the tone I got from it was more that she was just sad that this kid's mom wasn't really willing to give him the help that he needed. And so she kind of took on the role herself and just expressed how thankful she was to be able to have him in her life and be able to teach him what she could. Yeah, that's pretty much it.
That's awesome. Thank you. All right, sweet. So now we have to kind of talk about these other terms here. What did we learn from this experience about normative variation, maturational delay, transient disorders, or persistent impairments? Oh.
Trying to find that. You were coming through a little garbled. Sorry.
Oh, me?
Yeah, I didn't get. I mean, I heard it kind of, but I didn't. Some of the words were.
Oh, okay. Yeah. It was just we kind of have to talk about like all of our different experiences in terms of normative variation, maturational delay, transient disorders, or persistent impairments. And what have we learned about them? So, I
Do we
guess
want to
that,
just?
huh?
Do we want to just take turns, or?
I think that we can take turns, or we can just go through like one thing at a time, like what we think normative variation is and how it relates to each of those. So just briefly kind of touch on each of those. Okay. So let's go ahead. What do you guys think normative variation is and how it relates to what we've been talking about?
Well, I think somebody talked about personality, and I have 10 younger siblings, and I have four nephews, and 3 nieces, and like all of them are healthy children, or my siblings were healthy when they grew up, and none of us have like persistent impairments, but all of us have kind of variations, and I think a lot of times even sibling order, like whether you're the oldest or the second oldest or third oldest, because I know my younger brother didn't talk nearly as early as I did, and I think that's partly because he relied on me to communicate for him, or I was more dominant in my communication. So I just think that sometimes things that are seen as maturational delays are actually just contextual to the family or to the personality or individual schema of the child. So.
That's perfect. That's what I was thinking as well, is just how for every child their socialization is different. And like you were saying, like within the context of having older siblings or living in an orphanage or things like that, where how they've been interacting with people and how they develop, it's not only genetic, but it's also determined by experience as well. So what we might see as a delay might just be, it's completely normal. It's just that the child just it's child different and their experience is different.
Yeah, there are definitely different variations. Like, my niece does the talking for my nephew, so he didn't talk till he was almost 3. So there's those variations. You have to kind of, I guess, like what's the word I'm looking for? The normal development ages, like say this happens between 1 and 3. If it starts happening, at 5, maybe you should just look into that.
I think too, you just have to remember the plasticity of children. A lot of times, things that are transient disorder, maybe they have a speech impediment or they have they're slow on walking or something. A lot of those things can be supplemented and help so that long term they don't even become enduring factors in their development.
Yeah.
So I have class that starts at 12:45. I'm gonna have to book it out
That's
of here
okay.
simply.
That's okay. You've been
Thanks for
great, Vaughn.
Yeah,
Yeah.
no problem. I enjoyed it. So I hope if there's anything else that you need me to do, just send me an email and I'll get on it. But
Well,
I've got
I
to get
think
to class. So.
your contributions have been great. I think you're good to go. Have fun at class.
Okay, thank you. Yep,
Thank you.
bye-bye.
bye.
All right. Did anyone else have any other comments about normative variation?
No, I think we all pretty much agreed.
All right, perfect.
I was
All
just
right.
gonna say something real quick, if you don't mind.
Oh, great. Go for it.
Well, I was just agreeing with all of you that you know, that like personality you have to take into account. I know in my own family, like I have 3 other siblings and they all started walking at like a normal like 11, 12 months. But for me, I was like very shy and scared, and like I started walking like 13, 14 months just because I was scared, and it was just a personality thing. It wasn't really like a it was normal for me because that's just my personality. So I think that you just have to take into account for a personality, and you know, if they aren't meeting the milestones, then that's when you should be concerned.
Yeah, I think it's important for parents to kind of understand that what they think may be a developmental delay and may start, you know, being really concerned about and stressing out about really could just be a variation and have to do with their personality and their environment. And I think that's not really the thing we come to as parents. We think automatically like, oh, there's something wrong with my kid and I need to take him to a doctor, when we just kind of need to let them figure it out on their own. And then if they're still having problems, consult a doctor.
Yeah, exactly. Like, and kind of just touching on what you're saying, like, sometimes as parents, we were like, oh my gosh, my one child started learning this at this age, and now this child is learning it way late or way earlier. Like, is something wrong and stuff like that. And so it's not necessarily that anything's wrong. It's just that each of us develops at a different pace and stuff. But we eventually, so assuming it's healthy development, we reach each of those stages and stuff.
Yeah. I mean, I had speech delays before, and I mean, I had to end up like going to preschool and speech therapy just to help me get back on track. But that didn't mean I had any, like I didn't have any like mental or health issues. It just meant like since I was the oldest and I hung around parents a lot, like I just didn't learn to speak quite as quickly. And so I think there's definitely a difference between like speech delays and like your mental disorders that can come from those kind of diagnoses.
That's so true. Thank you for sharing that. What do you guys think about maturational delay? What are you guys' thoughts on that from what you guys have learned about this experience?
I guess delays could be kind of because of their environment or things like that. You know, if they're in an orphanage, they're obviously not going to want to talk as soon, or if they have an older sibling, that they're not going to want to talk as soon, or it could have to do with basically the environment, what's going on in their life at that moment, and things like that.
Yeah. Or even having older siblings can encourage them to speak a lot more quickly, because I have a younger sister who spoke a lot more quickly than all of us siblings combined almost, but it's also a part of her personality too. She loves to talk, and so I think that there's definitely, with delays, it definitely has to do with personality as well as what's going on in their environment.
I definitely agree that it has to do with both environment and personality, because I have a younger cousin. He's almost 2 years old, and he's very shy and quiet, and he's very like scared of other people. Like he just and like he doesn't really talk. He says like yes and no, and that's basically it. And he's almost 2 years old. But I think it's also the environment because he's the baby in the family and they kind of treat him like a baby, so he thinks he can get like away with that kind of stuff, and like they try to get him to talk, but he's just like, no, not gonna do it. So that's just both in personality and environment that have to do with it, I think.
Yeah. I think we just definitely need to examine the environment and, you know, the situation and their personality before we determine that they have a developmental or maturational delay.
I totally agree. I think that we have to be careful before we, because I think that sometimes we can get a little hypochondriac that way, where we just sort of like, oh my gosh, there's something wrong with my kid and stuff because they didn't learn it sooner or later or things like that. But it's just between their personalities and their environment, and also just accounting for their genetics as well, just the combination of it. There's just so many variations that can occur that, of course, there's going to be differences from person to person.
Yeah.
Alright. So what do you guys think about transient disorders?
Well, with disorders like how Vaughn was mentioning this with his child, that like he interviewed the mother, how the child like currently is diagnosed with autism. I mean, sometimes those diagnoses can like be changed at certain ages as they enter school years. But I mean, sometimes like some children are born with it. Like the little boy, it sounded like to me, he was born with it, and my sister was more so born with autism. And so it's just one of those things that like it's sometimes having a diagnosis early helps like get the intervention that they need, but doesn't necessarily mean that they actually do have that disorder or that handicap at all. So
exactly, and just kind of like, who was it? Was that was it you, Emily, or Brianna, who was talking about having to go to speech therapy?
that was me,
That was
Brianna.
Brianna.
Yeah, like just thinking about that, like just how it didn't last forever. Like you were able to go and get treatment for it, and you were able to come out of it just fine and stuff. Just like, but like had it not been treated, you might have not been able to speak. You know, just kind of thinking about that kind of stuff where it's transient because eventually, if we take the proper steps towards treatment, it'll go away and stuff. I guess.
Yeah.
I don't know.
Yeah, I would definitely agree.
I think we definitely need to be cautious, especially when kids are getting diagnosed so young with things like autism or ADHD, like things like that, when it's, you know, in reality it could be a 3-year-old boy and he's energetic and rambunctious because he's a little kid. And we need to, I think we try to label things to make, you know, the parents feel better and the people around us feel better. And we need to just really be careful about, you know, labeling someone that has a disorder, because as we were talking about, like it can be grown out of, and it could just be kind of situational at the moment and stuff like that.
Yeah, I mean, I do say like we do need to be clear about it, but at the same time, like there are those disorders, they retest them when they're like, especially like as they're going through school, they do retest them, especially like autism. And so they do try to make sure that if they did grow out of it, then they get them out of it. Because, I mean, 2 of my cousins did have an IEP for the longest time for cognitive delays, but they did eventually test out of their IEPs. So I think I think, yes, we kind of do need to diagnose children and label them just to be able to get them the intervention they need, but they don't necessarily need to have that label with their entire lives, I don't think.
Yeah. Yeah.
Exactly. I think
Definitely.
I think that there's a need to find a balance between being aware of signs of delays and disorders and then getting ahead of ourselves with diagnosing our kids and being like, oh my gosh, there's something wrong and stuff, and then like just kind of having a balance between the two, being aware of the things but also not getting ahead of ourselves.
I think that it's important to not focus on labels really. Like maybe your child does have like a label on them, but I think as a parent it's important to let your child know that that label doesn't define them and that's not who they are.
Yeah.
Definitely.
I'd just say be cautious, but not overly cautious. You know, like you were saying, don't freak out if he doesn't talk at 2 or something.
Mm-hmm. Exactly. Alrighty. And then there's persistent impairments and stuff, things that are like permanent, chronic, enduring, stuff like that. What do you guys think about that?
I think with the persistent disorders, I mean, my mom recognized within the first few weeks that she was born that she was very different from any child she's babysat, had before her, all that. Like, she could just tell. And at the time, since autism was not well known, it wasn't a common household name, um, a lot of the doctors were telling my mom that it was all her parenting. And so my mom had the hardest time, and I even ask her about those years, even to this day sometimes, and she's like, to be honest, I don't remember a lot of those years. I've kind of just buried them deep within my memory, and I don't want to remember those times in my life. And that's, I think, with persistent disorders, we have to be a little more open with them and being able to recognize them when the parent expresses concern about them, because we don't want to have the parent feeling like they are in the wrong and that they're really horrible, awful parent, because it doesn't get the child the help they need, and it doesn't help the parent with what they really need.
Oh, gosh. Any other thoughts on that?
I just agree with all of it. I mean, it's just we need to be just there for the parent, because it would be hard having a kid with that, and we need to, I don't know, just kind of show them the support and the love that they need and help them understand that this wasn't something that they did, and it's not because they are a bad parent. And then again, help the child understand that, yes, just because you have this disorder doesn't mean that that's who you are, and that doesn't mean that this has to control every aspect of your life.
Yeah, I agree completely.
I agree as well. Does anyone have anything to add to that before we move on to themes and patterns?
No, I don't think so.
Okie dokie. What are some themes and patterns that you guys have noticed throughout our discussion? I know for me, I kind of noticed when we were talking about the interviews and stuff that it was those who were professionals, or they were, or like whether they were teachers or nurses and stuff, those who were aware of the signs of these disorders and knew how to work with them. They weren't embarrassed. They didn't have trouble with these children and their disorders and things like that. They were able to identify it early on and get them the help that they need and stuff, even though it was kind of hard for them to realize, like, as parents or as relatives or whatnot, they were still able to handle it in a good way.
Yeah. I mean, I do realize that some parents like don't necessarily like recognize the signs, but I think there are some parents that do, whether it's because they have the degree or because they've just had a lot of experience with other children. But I do think like we do need to listen to parents if they do express those concerns, because sometimes the parents know the child even better than any health professional or teacher or any other professional that's out there that's working with the child. I think that all like we just need to be able to be willing to listen to the parent, because the parent does recognize the signs and does recognize when the child needs help.
Not only that, the parent spends most of their day with that kid. So you just need to be aware that the parent's obviously spending more time with that child than the person they're telling it to.
Exactly. I think that that's really important, that we trust parents' instincts and stuff, as well as because like as professionals, we kind of have that responsibility to be receptive to what the parents are saying about their children and things like that. And so I think that it's like, as you guys are saying, that we need to put a little bit more faith in the parents than we do, I guess.
I think that it can also flip the other way. Like sometimes parents might deny that their child has a certain impairment or disability, and they might not seek that treatment. So I think that, you know, if you see signs in a child, then maybe you should express concerns to the parent, and because sometimes they don't want to admit it to themselves and they won't find the treatment that the child needs.
That is a really good point and stuff, and that can be really dangerous for the children and stuff, because they aren't getting the help that they need to adapt to whatever delay or disorder that they have.
Like with the little boy's mom that I kind of interviewed, like his mom was just in complete denial and didn't want to accept that her kid had anything wrong with him. And because of that, he was a lot more delayed than he probably would have been if his mom was more receptive, open to getting him the interventions he needed and giving him the treatment and special care that he needed. I think in that sense, that's kind of one where you probably shouldn't listen to the parent as much.
Exactly. You know, that's hard, because sometimes like you don't have the chance to be around the kid, and so like you just thinking about all the kids that miss out on treatment because no one ever notices, you know, and the parents don't want to come to terms with it, or they ignore it, or whatever happens. Just all these children that are disadvantaged because of that. It's kind of sad to think about.
Yeah.
Yeah, and even if you're gonna like try and tell the parent that you think their child has a disorder, it's really hard to approach it, because you know somewhere in the back of their mind they've noticed. But granted, like for the most part, they don't want to acknowledge it, and so that you kind of have to be careful with how you approach them about it, because they're most likely not will, if they've already said, I don't want to acknowledge the fact that my child possibly has a disorder, then they are most likely not going to be willing to listen to any professional or any relatives about their concerns about their child having the disorder that he does have. And so you definitely need to find that balance of how do you communicate that concern without offending the parent further than what they already have considered themselves offended.
Yeah, definitely.
I agree that it's a very sensitive subject, but I think that also, like, in that situation, maybe not focus on the child, but maybe focus on them and just be like, hey, you know, it's okay to have this going on, and like offer your help and whatever that you, and offer just whatever you can do to help them.
Yeah.
Great. Did anyone have any final thoughts before we do a summary?
Nope, I think we're good.
All right, great. Will someone do a summary for us? I guess I can go ahead and do it. We each talked about our interviews. Some of us interviewed parents who did have children with disabilities and some who didn't. Um, for the most part, I guess I noticed that those who interacted with children with disabilities, they weren't really ashamed or embarrassed, things like that. And then as we were talking about it, we realized that there are many factors that contribute to what we might think are delays, things like that, such as personality and experience and genetics. All of those play a factor in the child's development. We have to be aware of those. Um, and uh, we also talked about being aware of the child's needs and listening to the parents and recognizing the disorders and things when they surface, so then the child can get the treatment when they need it most. That way they're able to come through all right. Is there anything that anyone else wanted to add to that summary? That sounds good.
Yeah, that sounded good to me.
Yeah, we pretty much all agreed on the same
Sounded
factors,
good.
but we just, yeah.
All right, cool. And on that note, we are done.
Yeah.
Hey.
Well,
Right.
good work,
All
team.
right.
Woohoo.